name is Mercedes Carnathon, Chair of the Council of Epidemiology and Prevention. I'm really excited today to have an opportunity to speak with one of the keynote speakers who opened up this year's Epidemiology and Lifestyle Conference.
My name is Renu Garg. I'm Senior Vice President for Cardiovascular Health at Resolve to Save Lives, and I'm excited to be here today.
Thank you so much for joining us, Dr. Garg. It was wonderful to hear from you in our opening session that sought to really highlight globally cardiovascular disease, where we stand, what some strategies are that we can use to improve cardiovascular health across the world. Would you mind telling our listeners a little bit about what you discussed in your opening address?
So, Resolve to Save Lives works to stop the world's leading killer, which is cardiovascular disease. 18 million deaths occur every year from cardiovascular disease, but it doesn't have to be so. We know that there are solutions that work. So my talk was about presenting 3 highly impactful interventions to reduce the burden of cardiovascular disease. First, treatment of hypertension, scaling it up and providing hypertension treatment at primary care level. Second, reducing dietary sodium intake. And third, eliminating trans fat from the global food supply chain. And we believe that these 3 interventions can help to save 100 million lives over the next 30 years from cardiovascular disease.
Thank you so much. You shared during your talk a really engaging example from a patient who went to the doctor because of back pain. And at his visit, they also screened him for high blood pressure. Would you mind sharing that story? Because I thought it was so impactful, especially your description of opportunistic screening.
Around the world, people are seeking care at health facilities for various conditions, but because hypertension is asymptomatic and silent, they don't get identified, diagnosed, and so there are missed opportunities. So this patient, Jagannath, just on this Monday, 4 days ago, uh, walked into a healthcare facility very close to his house at walking distance with complaints of backache. And as part of opportunistic screening, his blood pressure was measured, which was dangerously high. It was re-measured, and it was still above 160 systolic. So he was started on treatment as per a simple treatment protocol, and he walked back home not only for medication for backache, but importantly, life-saving medicines for hypertension. And the treatment he received is world class. The same medicines that a patient in the US would receive, this patient Jagannath walked back home with those medicines.
I think that story is really amazing because it's not hard to diagnose hypertension. And in many countries, you can even find kiosks to measure blood pressure. I was very struck a few years ago when I started to look at the role of hypertension in global disparities. And I was surprised to see that the burden is high across many different countries with many different economic backgrounds. What do you think is driving this very high burden of hypertension?
Yeah, so hypertension burden is high across the world, and 80% of those with uncontrolled blood pressure are actually in low and middle income countries. And what's worse is that at a global average of people with blood pressure control is 20%, but in low and middle income countries, it's only 10%. So that's where the most need is. What is driving it is one of the strong reasons why factors is our diet, which is high in sodium. 99% people around the world consume more sodium than recommended. WHO recommends 10 grams of salt or 5 grams of sodium, but most populations consume twice that amount. And so that is why for us, sodium reduction through a policy pathway is a very important intervention, which we believe will save millions of lives.
You seamlessly transitioned into the second point, which is sodium reduction. I think a lot of people think about sodium and they think about what they're adding to their food on the table, but it's more than that. And you mentioned policy. Tell me a little bit about how policy would be used to address the need to lower sodium in the food supply.
Yeah. By policy, if we can have a food supply environment where healthier choice is the default choice, that's what works. Uh, Behavior change alone, just by making
Yeah.
people aware, does not work. Behavior change in conjunction with policy change can work. So, in populations that consume, where most of the sodium comes from packaged food, like in many Western countries, policies to put warning labels on the front of pack, uh, warning labels on food products that are high in sodium, sugar, and fat or calories, like it is done in Chile. That can work. We've seen that there's evidence that's working, and many countries are adopting that. Fiscal policies to tax um, ultra processed foods, which can be another policy to discourage consumers from buying those products. And thirdly, in populations where most people um, add salt while cooking, like in Asia or parts of Africa, or there, policy for promoting low sodium salts that are enriched with potassium, we believe those are important, that can be an important intervention in those settings. So everywhere, it's policy that will help people to adopt healthier diets. Um, um, so I think the role of policy is extremely important for sodium reduction.
Yeah, no, I like that. And I really do appreciate the role of policy in creating a healthier environment. Um, I remain really interested in how sodium reduction works in lower income countries, where my understanding was historically things were stored with sodium, or kept fresh or with sodium. So, how do you address sodium reduction in lower income countries? Preservation, I think, was the term I was thinking of. Yeah, how do you address that in lower income countries?
Yeah. I mean, South Korea, where kimchi is one of the
Mm-hmm.
food that is high in sodium, which also for
Mm-hmm.
preservation, but also for it is one of their staples.
Delicacy, yes.
They successfully reduce sodium
That's great.
in kimchi, and they did that through technology. They developed so it's a very interesting case study which is published. So. But on the most of the sodium that the dietary sodium that comes in low and middle income countries is either salt added during cooking on a daily basis.
Mm-hmm.
In some countries, salt is added in staples like rice. So
Oh.
majority of the salt intake in Sri Lanka, for example,
Mm-hmm.
is salt added in that staple. So a simple message there is don't add salt to your
Oh, that's
staples.
great.
But in so most of the salt that comes is actually from salt added during cooking.
Oh.
But increasingly, we are saying that packaged food is also increasing. The consumption of packaged food is increasing very rapidly in low and middle income countries. And therefore, a combination of policies, both to address packaged food by warning labels, fiscal policies for taxation, as well as interventions like promoting low sodium salt,
Mm-hmm.
can be impactful and can make a difference in these countries.
Well, no, I appreciate that, and I think while we're on food, it brings me to trans fats. There have been efforts, certainly in the United States and certain cities, to ban the use of trans fats or substantially reduce the use of trans fats. In the United States, we do tend to get a lot of pushback from people saying that the government shouldn't tell me what to eat. And I'm curious, how have trans fat bans or policies around trans fat been received around the world?
Yeah, great question. In most countries, it has taken 3 to 4 years to get a policy passed through trans fat.
Mm-hmm.
So typically, we start by generating evidence to say there's a lot of trans fat in the food supply chain,
Mm-hmm.
and then we partner with local advocacy organizations that they use that data to create a social movement through advocacy groups, through consumer protection groups, and other advocacy ways to target messaging to policymakers.
Mhm.
And in most countries, we are seeing that countries are recognizing that this is harmful. There is no doubt about it, and policies are passed. But the process takes time. It takes
Ah,
3 to 5 years. And so when we started in 2017, we started, and in 2018 we partnered with WHO to create a technical package for trans fat policies
hmm,
called Replace.
hmm.
The acronym is Replace. At that time, 14 countries had passed trans fat policies, and in the last 7 years, 50 more countries have
Oh,
passed
that's
trans fat.
amazing. So
So
an
there's
entire
been a
country, not a city or locality
in the entire
within.
country. These are
Oh,
national
that's great.
policies.
Yeah.
So today, 64 countries have passed
Hmm.
trans fat policies. 50% of the global population is covered with those policies, up from 7% seven
Wow,
years
that is
ago.
impressive. It really does um, definitely make me want to follow up to ask you a little bit about Resolve to Save Lives. I mean, this has a substantial impact on health around the world, and the mission of your group may not be known, your organization may not be known. Can you tell us a little bit about Resolve to Save Lives?
Sure. So, Resolve to Save Lives was founded in September 2017 by Dr. Tom Frieden,
Mhm.
former director of US CDC
Hmm.
under the Obama administration. And so it was started with the goal to save as many lives as possible. We
Mhm.
work to prevent health threats. We focus currently on cardiovascular health and prevention of epidemics.
Hmm.
These are the health issues which cause the highest number of deaths.
Mhm.
And our mission for cardiovascular health is to save 100 million lives over the next 30 years with these focused attention. We work with laser focus.
Hmm.
We use the approach of simplicity, speed, and scale. If
Ah,
you have to
simplicity,
scale
speed,
things
and
for
scale.
something as big as hypertension, which
Sure.
is 1.3 billion people, interventions have to be as simple as possible, and we work with the
Hmm.
fierce urgency of now to scale up interventions around the world. Currently, we are working in almost 60 countries. We have partnerships,
Hmm.
and we are. And another approach we have is we believe in the three pillars: technical, generating evidence; operational, making things operational on the ground for scale; and policy, to bring about policy change through political buy-in. So TOP, that is technical, operational, and political, and we work with speed, simplicity, speed, and scale.
I love that simplicity, speed, and scale. So, I think as we wrap up, what I'm interested in finding out is that I think there are so many people who are going to hear this and be as excited as I am hearing about the organization and the work that you're doing. Given the changing landscape around global health within the United States and what may be funding constraints for us to do this work, what are the ways in which people can partner with or contribute to Resolve to Save Lives to continue to have an impact on cardiovascular health across the globe?
Great question. I think this is the leading cause of death around the world, and the low and middle income countries are the most affected.
Hmm.
The way to work is we are always looking for local partners and champions who can advance. The change that we need is in the change of behavior of policymakers, for them to recognize these are problems and that need to be prioritized in
Hmm.
countries, and to take decisive actions so that the public interest of public health remains paramount and above all other interests, to really push back against industry, which is always trying to defer and delay policy making. I believe that the governments of countries are at a very good in a place to make strong policies, to make healthier options available for their populations, and to provide care for conditions like hypertension that are safe to treat, easy to treat, and that will save the most lives.
Oh, thank you so much, Dr. Garg. I really appreciate you coming here, taking your time to share with our audience through the American Heart Association. Again, I'm Mercedes Carnathon, very pleased to be the Council Chair for Epidemiology and Prevention this year, and really honored to spend time with our keynote, one of our keynote speakers today. Thank you.
Thank you.